This is Dr. Tony Martin. I'm the staff veterinarian with MFA Incorporated, a regional co-op based out of Columbia, Missouri.
For MFA Incorporated, I'm Tom Stever on Brownfield Ag News, talking with Dr. Martin about the Veterinary Feed Directive. What is that?
Well, the Veterinary Feed Directive is it's actually a title and a regulatory activity involving feed additive antibiotics that was actually first put into law in 1996, but there's been a variation to it and a somewhat more relaxed law that is now going to be applied starting January 1, 2017 to an additional list of some 21 medically important feed additive antibiotics that will require the more involvement of veterinarians in the selection, use, and purchase of certain feed additive antibiotics.
There are 21 compounds that are involved in this. What's going to be the effect on livestock producers?
Well, for the use of these 21 particular antibiotics, and really it boils down to probably more like a handful of 7 or 8 that will be most notably affected for most of our livestock producers. For the use of those select ones, where they used to be able to walk into any kind of a distributor who had those products available over the counter in several different forms in feed additives or feed compounds, and just buy them according to their own wishes and their own needs. They're now going to have a veterinarian who will sign off on that and produce a veterinary feed directive document that will allow that purchase to occur. The products will still be available through normal distribution channels, but will no longer be able to simply walk in and purchase them unless they have this veterinary feed directive document on file.
Tell me what producers need to keep in mind to be sure that they are complying to this.
Well, number one, they need to establish a relationship with a veterinarian who can walk through and talk through the appropriate use of and proper selection of these affected antibiotics, and then be ready to create that veterinary feed directive document for them. So creating that relationship is going to be the number one key. And then two, it will be necessary for these producers, since they have used some of these products on their own in the past, to probably make a list of those products they've used, both feed and water medications, and use that as a discussion point with their veterinarian to decide which ones are necessary, and lay the groundwork and preparation for production of these documents so that they can be produced in a timely manner and kept on file, and make it still easy for the producers to access those products when they need them for the prevention, treatment, and control of certain diseases.
The production of farm animals has been affected quite a bit just by the use of antibiotics. The Veterinary Feed Directive, in your view, Dr. Martin, what is going to be the biggest effect on livestock production overall?
Well, the effect on the production itself is really going to be fairly minimal, because if producers have the proper relationship with the veterinarian and the proper documentation to judiciously use these products that are affected by the new law, it's not going to affect production at all, or it shouldn't. Now, the struggle will be for producers who don't have a relationship with a veterinarian or choose not to seek one to where they can access these products as they have in the past. They will be much more limited in their ability to actually prevent, treat, and control certain diseases, because they will be left only with over-the-counter injectables or bolus medications that are not affected by the law, and will not have the ability to treat animals as a group with these products that are affected by the new VFD regulation.
Now, you say it's important for producers to develop or to strengthen their relationship with a veterinarian. How are veterinarians affected? Are they going to have their hands full in helping producers comply?
It will be a somewhat of a change in activities for producers who already have a relationship with a veterinarian. I don't think it's going to create any additional burden on either the veterinarian or that producer. But for producers who maybe haven't used a veterinarian very much, or have not developed that close relationship where the veterinarian really understands what's going on in that production system, there will be more time and some expense involved in establishing a relationship and making those decisions about which antibiotics can be used, and creating the necessary documents to comply with this regulation.
For a company like MFA that markets feeds, what has this done as far as forcing you to reformulate some products?
Well, that's a good question. Going forward, I would assume that there may be some change in the mix of products that are made available through the distribution channels simply by what changes in demand for those products occur as the requirement for these veterinary feed directives comes into law starting next year. As we're sitting right now, we don't anticipate much of any change in the initial mixture of formulated products that we will make available, such as tetracycline-containing mineral for control of anaplasma. Those kind of products will probably still have the same mix, but depending on what the demand is for them, over time, I would see there will probably be fewer products that we have formulated with the antibiotics in them, especially as we make some changes in management and nutrition that may decrease the need for some of those antibiotic products, and that'll be one of the real pluses, I think, about this implementation of this regulation. As much of a headache as it might be, it will force veterinarians, producers, and us in the distribution channels to work more closely together to really make the proper decisions for the nutrition and management of the livestock we're producing that may in the long run give us a healthier animal with a stronger immune system that may need a little less in terms of antibiotic use to prevent, treat, and control disease.
So these products still may be available, although the procedure to administer or to feed or to acquire them will just be a little bit different?
Yeah, that's exactly right. That's exactly right, Tom. I think producers need to realize that this regulation is there. We're going to have to learn to live with it, and I think if we're going to approach it with a positive attitude, it's a very doable situation in spite of the disagreement with how the regulation was imposed, or maybe some disagreement with even needing it at all. And frankly, I think most of our food animal producers are very judiciously using the antibiotics that are available for prevention, treatment, and control disease, and really are no longer using those antibiotics for strictly production purposes like improvement in average daily gain and feed efficiency. And it's just kind of sad that we now have a regulation to try and ensure that, when I think we were doing a good job of it anyway. But my encouragement is to try and stay as positive about it as we can, to take the necessary steps to be ready to meet the letter of the law as it's implemented in January 1 of next year, and set the tone for responding to the demands that created this regulation, and prove to the consuming public that we are judiciously using those antibiotics to maintain the health and produce of the animals that we're raising, and therefore produce a very healthy food product for the end consumer.
We've been talking with Dr. Tony Martin about the Veterinary Feed Directive. For MFA Incorporated, I'm Tom Stever on Brownfield Ag News.